Have you ever felt like your body is trying to tell you something, but you're not quite sure what it is? Sometimes it's easy to brush off those little signals, maybe a twinge here or a pang there. But what if those signs aren't just random quirks? What if they're actually trying to alert you to something serious, like the health of your liver? In today's video, we're going to talk about some of the weird signs that your liver might be struggling. The liver is that unsung hero in your body, quietly working away to keep you healthy. But sometimes it needs a little extra attention. So keep your ears wide open and get ready to learn about some surprising indicators that your liver might be in trouble. Let's get started. Jaundice is the first sign we'll be looking at. Because other people can literally see this sign when they look at your eye. Jaundice is a manifestation of liver dysfunction that occurs when there's an excessive accumulation of bilirubin in the bloodstream, resulting in the yellowing of the skin, sclerae, the whites of the eyes, and mucous membranes. Bilirubin is a yellowish pigment produced during the normal breakdown of red blood cells. Normally, the liver processes bilirubin and excretes it into bile, which is then eliminated from the body through feces. However, when the liver is unable to metabolize bilirubin efficiently due to disease or damage, it builds up in the bloodstream, leading to jaundice. Various liver conditions can cause jaundice, including hepatitis, which is inflammation of the liver, cirrhosis, scarring of the liver tissue, alcoholic liver disease, liver cancer, and bile duct obstruction. In hepatitis, for example, the liver cells become inflamed, impairing their ability to process bilirubin effectively. Similarly, in cirrhosis, the progressive scarring of liver tissue disrupts its normal function, including bilirubin metabolism. Bile duct obstruction, whether due to gallstones, tumors, or other causes, can also prevent the proper excretion of bilirubin into the intestine, leading to its accumulation in the bloodstream and subsequent jaundice. Jaundice itself may manifest differently depending on the underlying cause and severity of liver dysfunction. In addition to the characteristic yellowing of the skin and eyes, individuals with jaundice may experience other symptoms, such as dark-colored urine, pale stools, abdominal pain, nausea, vomiting, fatigue, and itching, also known as pruritus. Furthermore, the presence of jaundice may prompt further medical investigations to determine the underlying cause of liver dysfunction, which may involve blood tests to assess the liver function, imaging studies such as an ultrasound or MRI, and sometimes a liver biopsy for definitive diagnosis. If you've seen or heard about jaundice and would like to learn more about signs that show your liver at risk, give me a thumbs up. Sign number 2 is easy bruising or bleeding. The liver plays a crucial role in the production of various proteins called clotting factors, which are essential for the normal clotting of blood. When the liver is damaged, either due to chronic conditions like hepatitis or cirrhosis, or acute issues such as liver injury, its ability to produce these clotting factors may become impaired. As a result, individuals with liver dysfunction may experience a tendency towards easy bruising or prolonged bleeding, even from minor injuries or cuts. This occurs because the blood takes longer to clot without an adequate supply of clotting factors. Additionally, the liver is involved in the breakdown of old blood cells, and when it's not functioning properly, the balance of bilirubin, a byproduct of this process, may be disrupted, leading to a buildup that can further contribute to bruising and discoloration of the skin. Sign number 3 is ascites, also called swelling of the abdomen. Ascites is a condition characterized by the accumulation of excess fluid within the space in the abdomen that contains organs, such as the intestines, liver, and spleen. This space is called the peritoneal cavity, and this condition is a common complication of advanced liver disease. This fluid buildup occurs primarily due to the liver's diminished ability to produce albumin, a protein crucial for maintaining fluid balance in the body, as well as the increased pressure within the veins of the liver, portal hypertension, which causes fluid to leak into the abdominal cavity. Ascites is typically present as progressive abdominal distension or swelling, often accompanied by discomfort, bloating, and a feeling of fullness. Sign number 4 is unusual fatigue. Fatigue, often described as extreme tiredness or lack of energy, is a symptom that can manifest in various medical conditions. However, when fatigue becomes severe and persistent, particularly if it's unexplained and does not improve with rest, it may raise concerns about underlying liver disease. The liver plays a crucial role in metabolism, energy production, and the removal of toxins from the body. Therefore, when the liver is compromised or diseased, it can lead to disruptions in these vital functions, resulting in profound fatigue. In liver disease, fatigue may be multifactorial in origin. Liver dysfunction can impair the body's ability to store and release glycogen, a form of stored glucose that serves as a primary energy source. As a result, individuals with liver disease may experience fluctuations in blood sugar levels, contributing to feelings of fatigue and weakness. Also, liver damage can disrupt the synthesis of proteins and other molecules essential for cellular energy production, further exacerbating fatigue. Sign number 5 is hepatic encephalopathy. Hepatic encephalopathy represents a spectrum of neuropsychiatric abnormalities that can occur in individuals with advanced liver disease. The condition is characterized by alterations in cognitive function, mood disturbances, and changes in consciousness, ranging from mild impairment to severe coma. Hepatic encephalopathy arises due to the liver's inability to effectively metabolize ammonia, a byproduct of protein metabolism. Normally, the liver converts ammonia into urea, which is then excreted from the body via urine. However, in liver disease, ammonia can accumulate in the bloodstream and cross the blood-brain barrier, leading to neurotoxic effects. It's believed that elevated ammonia levels disrupt neurotransmitter balance and neuronal function in the brain. As a result, individuals with hepatic encephalopathy may experience a wide range of symptoms, including confusion, forgetfulness, irritability, personality changes, and impaired concentration. In severe cases, patients may exhibit asterexis, which is a flapping tremor, slurred speech, and ultimately progress to stupor or coma. Hepatic encephalopathy can have a profound impact on a person's quality of life, affecting their ability to perform daily tasks, engage in social interactions, and maintain independence. Sign number 6 is a loss of appetite and weight loss. Loss of appetite and unintentional weight loss are common manifestations of liver damage, often occurring due to the disruption of metabolic processes and hormonal imbalances triggered by liver dysfunction. The liver plays a crucial role in metabolism, including the processing and storing of nutrients obtained from food. When the liver is compromised, such as in cases of liver disease or severe damage, its ability to properly regulate metabolism is impaired. This can result in a decreased appetite, as well as a reduction in the body's ability to absorb and utilize nutrients efficiently. Furthermore, liver damage can lead to alterations in the production and secretion of hormones involved in appetite regulation, such as leptin and ghrelin. These hormonal imbalances can further contribute to a decreased appetite and subsequent weight loss. Additionally, the presence of symptoms such as nausea, vomiting, and abdominal discomfort, which are commonly associated with liver disease, can further suppress appetite and exacerbate weight loss. Sign number 7. Dark urine and pale stools. Dark urine and pale stools are classic signs of liver dysfunction that warrant attention. The liver is responsible for producing bile, a digestive fluid essential for the breakdown and absorption of fats in the intestine. Bile is excreted into the digestive tract and eventually reaches the stool, giving it its characteristic brown color. However, when liver function is impaired, the production and secretion of bile may be disrupted, leading to pale or clay-colored stools. Conversely, bilirubin, a yellow pigment derived from the breakdown of red blood cells, is normally processed by the liver and excreted in bile. In cases of liver dysfunction, bilirubin may accumulate in the bloodstream and subsequently be excreted in the urine, giving it a darker hue. This phenomenon, known as bilirubinuria, results in dark urine, which can range from amber to brownish in color. Sign number 8 is itchy skin. Pruritus, commonly known as itching, is a distressing symptom that can occur in individuals with liver disease. Itching associated with liver dysfunction often results from the buildup of bile salts in the bloodstream. Normally, bile salts produced by the liver aid in digestion and are excreted through bile ducts into the intestines. However, when the liver is impaired or damaged, bile salts may accumulate in the bloodstream instead of being properly eliminated. This accumulation can trigger itching sensations throughout the body, particularly in the hands, feet, arms, legs, and abdomen. The exact mechanism by which bile salts cause itching is not fully understood, but it's believed to involve their interaction with nerve fibers in the skin. Pruritus can range from mild to severe and can significantly impact an individual's quality of life, leading to sleep disturbances, irritability, and skin damage from scratching. Sign number 9 is spider angiomas. Spider angiomas, also known as spider nevi or spider telangiectasia, are superficial blood vessels that appear as small red or purple lesions on the skin surface. These lesions often have a central arteriole with radiating capillaries resembling a spider's body and legs, hence the name. Spider angiomas commonly develop in the upper body, including the face, neck, chest, and arms. While they can occur in healthy individuals, their presence, particularly when numerous or persistent, may indicate an underlying liver disorder. The exact cause of spider angiomas in liver disease is not fully understood, but is thought to be related to alterations in hormone levels and blood flow regulation associated with liver dysfunction. Elevated levels of estrogen, which are not effectively metabolized by the damaged liver, may contribute to the development of spider angiomas. Additionally, changes in blood vessel structure and function secondary to liver cirrhosis can promote the formation of these vascular lesions. Spider angiomas are not typically painful or symptomatic, but can be a visual indicator of liver disease and may prompt further medical evaluation. And there you have it, 9 weird signs that your liver is waving red flags. It's important to note that these signs and symptoms can also be caused by other medical conditions, and a proper medical evaluation is necessary for an accurate diagnosis and appropriate treatment. So if you suspect that you have liver issues, it's crucial to seek medical attention promptly. Remember, early detection and intervention can be life-saving. I hope you found this video eye-opening and empowering in decoding your body's messages. If so, please show your support by liking and subscribing to our channel for more insightful content on health and wellness.